And there is good news for those struggling to meet the Monday midnight health insurance deadline. The White House gave a 24-hour extension to those registering on healthcare.gov. This decision comes as a record number of people tried to sign up on the government website on Monday to start coverage by January 1st. Joining us by phone is Errol Pierre. He is the Assistant Vice President of Product Management at Health First, a healthcare advocacy group. Errol, thank you so much for being with us on the phone. I know this is a very busy time for you right now.
My pleasure. Thanks for having me.
I do appreciate it. So the first question is, how much traffic are you aware of? How busy is this website right now as people try to make this deadline?
Yeah, I can tell you we've heard, at least for the New York marketplace, there's estimates of 1,500 calls per hour. There's definitely overwhelming interest in the past week as the deadline closely approaches. So a lot of folks are going to the website trying to get covered before the deadline.
People get the coverage that they need. Are people able to navigate the website, particularly the federal website, and sign up?
Yes. So the federal hub fix that went in November appears to be working, for the majority of the time. There's been some downtimes, but for the most part, it's been working, and people have been getting access and been able to get on and find out their subsidies and enroll.
Yeah, I know that's good news for a lot of people. Tell us, let's go through these deadlines. We've talked about this many times before, but of course we found out today that the Obama administration extended the deadline for 24 hours for those who want coverage by January 1st. And then beyond that, remind us of all the other pertinent deadlines.
Sure. So the original deadline was the 15th. It got moved to the 23rd. The federal exchange announced today they have an extra day. So that's roughly 35 states that use the federal marketplace. And then you have to check on a state-by-state basis whether those individual states decided to extend the extra day as well. I know for a fact New York has, but I can't confirm that every state decided to give the extra day.
And so much has been made of the way for this law to work and to be funded, quite frankly, is for young, healthy people to sign up in large numbers to pay for the cost of those who are older or have pre-existing conditions. Do you have any information about the demographics of who's signing up?
Actually, so there's been some studies. McKinsey has one out that's for early indication that says that the folks enrolling are slightly older, a slightly older population than what was originally forecasted. But the real issue is we don't know who's going to actually be enrolled on January 1st. A lot of these folks that are enrolled owe premium, and they have to pay that premium before they actually get effectuated and get signed and get enrolled. So it could skew either way, but as of right now, the folks that are in and haven't signed up are a little older than what was originally forecasted earlier on in the year.
All right, and since you brought up paying the premium, what's the deadline for that? People have to sign up by 11:59 a.m. on Christmas Eve, but they also have to pay that premium for it to kick in. What's that deadline?
Correct. So going into the last week, the deadline was the 1st. There were some states that had some deadlines post the 1st, but there was actually relaxed guidelines sent from the federal government over the weekend, allowing plans to say, hey, because we extended open enrollment, we'll also extend the amount of time you have to pay, and to give people at least 10 days to pay. So there's some states that are saying, hey, you can pay past the January 1st into the 10th, giving more time for folks to pay that first bill.
And tell us about what's going to happen to these millions of people whose policies were canceled because their existing policies didn't meet the requirements of the new law. I think the administration has extended some sort of grace to them as well.
That's correct. That was another weekend update where there was originally catastrophic coverage, which was for folks who were under 30, and specifically for that group of folks. But what the White House did was extend that coverage to those folks who received those termination letters under the auspices of a exemption. So basically saying, we understand you lost your policy, you can get an exemption which can allow you to either get the catastrophic coverage or bypass the mandate to get coverage so they wouldn't have to hit the penalties.
And Errol, from the health insurers' standpoint, I know that as the Obama administration has made these tweaks and these revisions, it's created some confusion within the healthcare industry, the health provider industry, I should say, health insurance provider industry. Is some of that confusion dissipating now? Are insurers now a little bit more sure of what they are to do and what's expected of them?
I think that when we get into January, we'll hear some stories about provider confusion, physician confusion, hospital confusion, and even the policyholder confusion, because there has been a lot of changes. Not everyone's up to speed on all the changes, and it's hard to, launch this with all the changes that have come down. So we're doing our best to communicate as best we can, but I think there's going to be some misinformation out there from a lot of people that enrolled.
Okay, let's move beyond the December 24th deadline for getting insurance by January 1st. Say someone wants to sign up sometime in January, wants to beat that March 31st deadline. When they sign up, how long does it take for their insurance to kick in?
Sure. So the next date for coverage is February 1st, and you have to enroll before the 15th of January next year to get the February 1st date. If you enroll on the 16th of January, then you would have to wait till March 1st. But there is an ability to get coverage sooner if there's a qualifying event. So if something happens, say you have a baby, or something happens to your lifestyle and it changes, you're able to enroll and it would go back to the date of that qualifying event.
All right. And then finally, if someone, for some reason, 4 months down the road now misses the March 31st deadline to avoid that April 15th penalty, what happens to them? I'm assuming they can still sign up, but they'll still be responsible for that penalty?
So if they're signing up on the exchange, open enrollment will be closed after the 31st. And the only way to pierce it would be, again, that qualifying event. So they have to enroll before the deadline ends.
And the open enrollment will open up again, because with corporations it's annual. When will it open again for those who want to do it through the exchange?
It would be November 15th.
November 15th.
Of the following year. So next November they would be able to enroll. And if they wanted to, there is options outside of the marketplace, outside of the exchange. They can enroll at any time. And this is for the individual market. Small employers can enroll every month.
Got it. Errol, you are a fount of great information. Thank you so much. Errol Pierre.
Thank you.